Ladies and gentlemen,
This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week has been in the industry for over 20 years, first starting off at a small boutique laboratory wearing multiple hats, and now he's currently working at Keating Dental Arts as a Senior Technical Advisor. In this week's episode, we're going to be discussing impressions, the materials, how to recognize certain things about the impression before it even leaves your office so it can potentially save you time and money on the back end. So without further delay, please welcome Mr. Barry McGinnis. How's it going, Barry?
It's going great, Brandon. How you doing today?
Oh, pretty good. Thank you.
Yeah, thanks for having me.
Yeah, so today we're just going to be kind of hitting on little brusher points of what we see about impressions coming in and how those certain things can be avoided in a certain sense, or how to recognize them before the impression even leaves the office. So one of the most common things that we tend to see here is the body setting up before the wash material. So how can this be recognized, and what can we do to avoid it?
Well, it's pretty easily recognizable. I feel like it should be recognizable, before the impression is sent to us. But once we get that impression, once it's evaluated, looking at the impression, you can tell that the wash has been pushed away from the prep down into the vestibule. We want to have that wash material all around the prep, all around the occlusal surface of the prep. But yeah, I mean, we do see quite a few of those impressions that have that issue. I feel like we have better success when we don't see that kind of thing.
Yeah. No. What kind of results happen when we see the heavy body setting up first and pushing all the wash away?
The main thing we see is the delamination. That separation between the wash and the putty. Once we pour that up into the plaster model, we most of the time will end up with tight fits for those crowns. And yeah, it's not ideal for what we're doing here.
Yeah, no doubt. Ends up with a more chair side adjustment on the intaglio.
Yeah, definitely.
Now another common thing that we see here in the laboratory is tray impingement. When a patient's biting down, and it can cause an extremely tight fit, a loose fit, wide open margins, a whole array of different things. Yep. So could you give some tips on how to recognize this in the office chair side, as well as what can be done to avoid it?
Yeah, I mean, of course, again, before the impression's sent in, if it's just evaluated, you can usually tell that kind of thing when something is hitting the tray. But yeah, I mean, it's really just an evaluation, just looking at it, checking it out, making sure that it didn't hit. Yeah, I mean, I don't know what else to say about that.
Yeah, pretty much. If you have an exposed impression tray, that it, where it's coming through
it should be obvious.
Impression material, that it was contact.
Yeah.
Yeah. Now, can you give some ways to avoid that certain tray impingement or recommendations?
Well, using the proper tray for that patient, for that arch size, for that mouth size, that's the main thing. But, custom trays, Quadrant impressions, the clinician's choice is probably the best for those quadrant impressions. The metal trays usually aren't recommended, but yeah, I feel like it's usually the trays that is the issue. If they're using the proper tray for that patient, then they should be good. Yeah,
those plastic ones that spring back due to the memory of the plastic.
Yeah.
Yeah, and that's you mentioned the clinician's choice tray, the Quad Tray Extreme. Certainly a big promoter of that tray because of the fact it doesn't have memory. If you bend that metal, it stays in that position. So pretty user friendly. Plus, then you're not having to, jam in a full arch tray when you still can use a quadrant or something. Yeah. Definitely patients, I think, would prefer that.
Yeah, most cases where they're using the clinician's choice in trays, they tend to be more accurate and more successful. Definitely.
Nice. Now, when it comes to implants, here at the laboratory, I mean, I know it's kind of something different when it comes to chair side when you have the patient right there. Yep. But pros and cons about open tray and closed tray impressions. Can you share a little bit with us on that?
Well, open trays definitely recommended. When you can lift that transfer assembly in the impression, it's going to be far more accurate for the final restoration. They do take a little bit more time, but they're definitely more accurate and worth that time spent. I mean, the orientation is going to be more accurate when nothing's removed from the impression. We do have a product, I believe you know about that product that's recommended, the knockout trays, right?
Yeah.
Dental Tree.
Yeah, correct. Actually, gentleman came up to us, Trent, holler out there, at the Midwinter show at Chicago, actually brought him over, gave us a couple samples, and pretty cool little units where they actually, all the bottom part of the tray is in little segments, so then you can just pop out those areas for the open tray impression, so you don't have to, drill through your tray or through that acrylic you're doing some type of custom.
That's a new product that's new on the market?
It's fairly new. It's been around for a little bit, but he was just starting to push it there, so I think that would be very helpful for our dentists out there to have a nice, easy solution.
Yeah.
Versus even creating a custom tray that then has that opening for the.
Definitely going to save time and money.
Yeah, certainly. So, with the knockout trays as well as the clinician's choice trays, we'll have those down in the show notes with links so that they can be easily located and y'all can take a look at that. Now, I think we've all seen it at times where we come in and there's nobody in the room and the patient is sitting there holding their own tray. Sure. It happens sometimes. As busy operatories, you got to be moving, but share your thoughts.
Yeah, definitely not recommended. We don't want the patient to be involved in that way. We just want them to bite down and relax. We don't want them putting their hands up and getting involved in that. I think the doctor or the assistant can definitely handle that. And I feel like it's not a good idea because they might move it, and you don't know if they've moved it. So it's probably best to have the doctor handle that.
Yeah, that's very true when it does move, and it's so hard to tell when you're just looking at the impression because it's kind of like that negative, of the image, and then you pour it up in plaster, and then you get the positive of it, and then all of a sudden, there's multiple occlusal surfaces. It's been double impressed, something shifted way over.
Yeah, and sometimes you can't tell until it's poured in plaster. Yeah, you see the positive, like you said. Yeah.
Yeah, and we even see that sometimes with the pulls where the impression syringe gets pulled away and they're not injecting more material, and it ends up getting that nickname of the pull in the impression.
Yeah.
That too sometimes can be a little bit more difficult when you're just looking at the impression, but then you pour it up and it's like, oh my goodness!
And you see the obvious distortion or the flash from the plaster.
Yeah. So definitely. Make sure and keep injecting the material as you are pulling away that syringe for the wash.
Yeah, that's a good tip.
Now, expiration dates.
Yeah, I know. It should be, an obvious thing, but it's a good idea to always check the expiration dates of impression materials. When things expire, they don't react the same, they don't act the same. But just making sure that you're using things that aren't expired is a good idea. They don't set up properly if they're expired, and we do see sometimes we do see some impressions like that, and usually we can tell. So you would think that they would be able to tell before it's sent to us, but sometimes not. I mean, sometimes they're not seen. Just double check those expiration dates, please. Please.
I know you and I together have seen it a couple times where impressions come in and they're still tacky and all that. It seems like I've seen it happen with polyethers more.
Yeah.
And polyvinyl siloxane, but
it's more common with that.
And then also seen that material break down in like extreme cold and heat. Also, I don't really know the science behind that, but certainly something to be looking at going for. PVS seems to hold up quite a bit better.
Yeah, it does. It definitely does.
So when it comes to doing just quadrant impressions versus full arches, share some thoughts on that if you could, please, Barry.
Well, single unit posterior cases, that's perfectly fine for a quadrant impression. When you start getting into more units or bridges, we do suggest sending full arches. It tends to be a little bit more accurate, and we do articulate those models a lot easier when they're full arches. Well, also veneers. Veneers are the other ones we like to get full arch impressions. They're definitely more ideal.
Yeah, it certainly helps when you're designing for function.
Yeah,
to make sure that that's it.
And we've seen a quadrant impression, and then doctor requests that we match the contralateral, and how are we supposed to match it if we don't have the whole arch?
I don't have that information.
Yeah.
Oh goodness. And also that what it seems like sometimes we'll get just the quadrants when the terminal stop has been blown out. We don't have anything else there, and patients can overclose. So certainly good thing to do there too. And I know if we do have the terminal stop in place too, just kind of on a sidetrack note here, one of the things that Sean taught me years back was go ahead and take that bite registration before the patient gets numb. So they're biting naturally. Boom, everything's in there. We got occlusal stops, distal and mesial to the preparation.
Yep.
Get that bite registration first. Bam, you get that. Everything locks right in your articulation, and it's good to go.
Yeah, that's a good idea. Definitely.
So, and then I don't know. Other than that, you can always do that at the beginning, and then maybe go back and reline it, and add more material to it, and that can help out quite a bit because it's helping to guide the patient back into their natural bite. So, I think that you and I have seen that it's pretty common that patients move into a protrusive.
Yeah, definitely.
When they're getting their impressions or the registrations.
Yeah. When they're numbed up at the end and they're trying to take a bite registration, a lot of times they just don't bite correctly. Yeah.
So it's a pretty common thing in the operatory. You'll get a patient that comes in and they have a high gag reflex or very sensitive to a gag reflex. Got any tips that could help out our practicing doctors with taking those type of impressions?
Yeah, definitely. Not taking a physical impression and actually doing a digital impression, avoiding physical impressions altogether. I mean, that's the obvious one. The other one is using a lower arch tray for a maxillary impression. That can definitely help. And when that soft palate's pressured and they start to gag, it can be tough. But yeah, I mean, of course, digital impressions. It's the future.
Yeah, it is.
Yeah,
definitely.
That's a good idea.
Gotta love the digital impressions, and you're just in there with the wand.
Yep.
Getting that scan done, and also that bonus is all these other things that we've mentioned so far are eliminated or no longer a concern. And you got it in real time. You can evaluate your prep, saving the patient time and money, everything with the turnaround of it. And that comfort level. And
for the patient, definitely. Yeah, that's a big advantage, those digital impressions for sure.
Yeah, and so it's eliminating all that expansion contraction. So I mean, if you're listening to the show, I always talk pretty highly about the digital impression taking because it's just wonderful, definitely a thing of the future. So and I'd say probably roughly right now we're about 40-60 of what we see here in the laboratory for digital impressions versus analog physical impressions coming in.
Yep.
And pretty exciting moving forward. I mean, the whole industry has been pretty much on board for a while now with the modelless full zirconia, the monolithic units that can be done modelless or even EMAX. But pretty excited now because we're moving forward with our digital dentures too, which we also just launched at the Chicago show. So pretty excited for that. Saving, again, doctors and patients time, money getting those things back real fast, the try-ins. So if you'd like to learn more about that, check out, I think it was our episode last week that launched where I was speaking with Mr. Jim McGinnis, and there's some more detail on the digital dentures there.
This is the Dental Up Podcast.
So a lot of times in the operatory, you're moving fast. There's a lot of other patients waiting. You could have multiple operatories where you're bouncing around, and the set time can come into issue. Whether you have the crown and bridge set, the multi-units, like how long that can really go. Is there any way to save some time on that process?
Well, I don't think there's any way to save time. I don't think you want to save time in that process. You want to make sure that you do it right, even if it takes a little bit more time. You want to, base it on the manufacturer's suggested time, and then maybe add a little bit of time to that, 30 seconds to a minute. That helps just to prevent, the margins tearing when you remove that impression. But yeah, I wouldn't try to save time in that area. Just make sure you do it right. Take a little bit extra time, and make sure you're doing it based on the manufacturer's suggestions.
Right, taking the time on the front end usually saves you time on the back end.
Exactly, it's going to save time and money on the back end, or an adjustment or a remake that has to be done. So yeah, it's a good idea to take your time and do it right.
So when it comes to removable impressions, that's one thing that we do see from time to time is the full border importance of it. So that's always something really important to make sure you're getting that full border impression. And again, when it comes to digital dentistry, you can do that as well. I mean, have you had that type of experience also, Barry?
Yeah, definitely. Yeah. We want to make sure that full border is there for those removable impressions. And being sure to capture the whole palate, the whole thing. You want to make sure it's that really large impression, and it usually results in accurate, dentures and partials.
Well, certainly. And I know that Ivoclar also has a product to help convey the patient's vertical when you're doing digital impressions with with a removable product. So we'll make sure and have that link below also, because that's a really interesting tool to use.
Yeah.
And it's completely autoclavable, so that's great. But hopefully this has been informative for some people. You recognize these certain things, or be looking for them in your impressions and notice it before it goes to lab, and then you get that rare chance to make that second impression to have a better result in the end. Well, Barry, I know you're a busy man, so I appreciate you swinging by doing the podcast with us today.
Anytime.
All right. Take care of yourself.
Of course. Thank you. Thanks for having me.
Bye-bye.
Bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.